So the media are promulgating a narrative. The narrative is that red is very bad and blue is very good. Now, in order to do that, they also have to explain away Andrew Cuomo. So they've decided that they're basically going to now recapitulate the Andrew Cuomo is the best governor in America story, which is just, it's amazing. I mean, the utter gall of people to suggest that Andrew Cuomo is a good governor, it's incredible. Okay, so they have to do two things. One, blame the red governors, and two, somehow rehabilitate Andrew Cuomo. And so the media are full on board with the rehabilitation of Andrew Cuomo. And Andrew Cuomo, I mean, I'll give this to the man. The man has serious stones. I mean, to oversee a state where 30,000 people die and then sit around ripping on states where like 3,000 people have died with the same population. And by the way, places like Florida are disproportionately elderly. Obviously, big nursing home population in Florida, but they didn't see a vast killing of the elderly. For Andrew Cuomo to be going around ripping on others is incredible. So here's Andrew Cuomo suggesting that Trump's decision to reopen the economy was wrong. Quick note, when Andrew Cuomo says things like this, recognize that the lockdowns in New York City may not, in fact, have been responsible for the actual decline of cases in New York City. It is possible that what happened is that it ran rampant through the population and knocked out everyone it was going to knock out. I mean, that is a real possibility in places like New York, because what you're seeing right now is that New York is reopening. New York is starting to open. We've seen pictures of people who are hanging around outside of bars in New York, right? Big crowds in New York. And they're not seeing a significant uptick in the number of cases. Maybe that's because a lot of people have already had it. And so they are not now transmission vectors. We don't know the answer to that. So it may not be that Andrew Cuomo's policy was all that good. It may be that he basically achieved a certain low level of quasi-herd immunity by allowing this many people to get the thing. Okay, so anyway, here's Andrew Cuomo suggesting that it's Trump's decision to reopen the economy that's caused all of this, which is weird because he's not in charge of states, is he?
Are you now thinking that maybe we might not see everything goes remote now in the fall, given we're living with this virus until there's a vaccine?
Well, your first point, yes, I agree with that. Everybody talked about the economic consequence, and the president said we should reopen and that's going to help the economy. It turned out to be exactly wrong. But there's also a social consequence.
Okay, well, he didn't turn out to be exactly wrong. We're actually seeing a shocking V-shaped recovery in the economy. As people go back out, it turns out the economy has been upticking at a rather rapid rate. But it's not just Andrew Cuomo who's now trying to rehabilitate. Mark Levine, who's just a disaster area. Mark Levine is, of course, the chair of the New York City Council Health Committee. Right? He's also the same guy who claimed in the middle of this pandemic, first he told everybody to go out to Chinatown and party it up. Then Mark Levine claimed that the protests were going to be fine. The protests were totally cool. Now Mark Levine is claiming, and by the way, if you got it at the protests, it's because of racism. Racism was the cause of the uptick in COVID. Now, he's just frankly lying. He says, on the single worst day in New York City, back in mid-April, we had under 8,000 new cases. Well, no, your testing was off by like an order of magnitude. You did not have only 8,000 positives in a day. If you'd been testing properly, the number would have been a hell of a lot higher than that. The reason he's saying that is because Florida had 9,000 cases yesterday. Now, again, if you look at the Florida numbers, if you look at the state-by-state numbers in the United States, what you actually see is that Florida is basically stable in the number of deaths it's been experiencing on a day-by-day basis. I'm actually looking at the Florida statistics right this instant. And what you've seen, daily deaths per day in Florida, I'm going to read you since June 16th. 55, 25, 43, 40, 17, 12, 64, 45, 44, 37, 26, 27. Does that sound like an incredible, massive uptick? Like vast scores of deaths? Like, again, maybe it will happen. It could seriously happen. I mean, you're seeing more cases. It means more hospitalizations. But this notion that New York City somehow handled this thing well, and that Florida's handling this thing badly, and that we are seeing, vast numbers of deaths in Florida, not so far. Now, again, that could all change. It could be the health system gets overwhelmed. And it is important to recognize here that there is no way that a lot of people are not going to get this. The whole purpose of flattening the curve was not to change the area under the curve. I've explained this 1,000 times on the show. The whole point of flattening the curve was to prevent the overwhelming of the healthcare system. There has yet to be any serious evidence that Florida is being overwhelmed in terms of its healthcare system. In fact, Ron DeSantis did a presser yesterday in which Ron DeSantis explained at length that Florida is not being overwhelmed. He says basically the number of people who are getting hit here, it's mostly people who are young. You're mostly seeing this in people who are young. And by the way, before I get to DeSantis, you can see that this is the reality, right? You can see in the chart of diagnosed cases versus deaths, you can see that there's this vast gap that has now emerged that shows that there's a huge, huge disparity between the number of diagnosed cases and deaths. Do we have that chart? It's a chart of diagnosed cases. couple more charts. Let's see. Keep going. There we go. This is the 7-day moving average of reported COVID-19 cases and deaths with the 7-day lag. And what do you see? You see the lines completely diverging, right? They were basically on point up until late April. Then the deaths started to drop rapidly, and the cases started to level off and then rise rapidly. Now, maybe that red line is going to turn around. Maybe you're going to see a big spike, but we haven't seen it quite yet. So the idea that New York handled this thing right and Florida handled this thing wrong, I'm waiting to see any evidence of that whatsoever at this point. By the way, again, it makes me crazy, but the idea that New York did this thing absolutely right is totally crazy. I mean, here is a chart of the New York excess deaths in nursing homes. Suffice it to say, this does not look good for New York. Okay, this is the total weekly deaths from COVID-19, in particular metropolitan areas, above the normal, right? This is by percentage. This is the total COVID-19 deaths in entire metropolitan area in thousands. And what you see is excess deaths. Look at that spike in New York City metropolitan area, right? It's unbelievable. And then when you look at the actual percentage basis, what you see is that places like Cleveland or Detroit may have seen like 3 times as many people in nursing homes die as normal. But if you actually look at New York, it's like 35 times as many people died in nursing homes as normal. Okay, that is a giant fail by Andrew Cuomo and by the New York City government. But apparently, again, the bad guys here are the people in the red states. We're going to get to more a lot of this is just lying. It really is. It's lying with statistics. This video is sponsored by Blinksale. It is the revolutionary invoicing software for small businesses. Spend less time billing, more time making the money with Blinksale. Go down to the link in our description and give it a click.